Welcome to Insider Medicine in Depth. I'm Dr. Susan Sharma. A new drug with a similar but more potent mechanism of action, imatinib, commonly known as Gleevec, appears to be more effective for the treatment of chronic myeloid leukemia, according to research published in the New England Journal of Medicine. Here is some information about chronic myeloid leukemia, also known as CML. It is a slow progressing cancer found in the blood and bone marrow. It results in the overgrowth of immature, malfunctioning white blood cells. A major cause of CML is believed to be a genetic mutation that results in the development of an abnormal chromosome known as BCR-ABL. Researchers from the University of Turin treated nearly 850 patients suffering from CML with either a low dose or a high dose of a new drug known as nilotinib or with Gleevec. The patients were followed for up to a year. At the end of the follow-up period, more than twice as many of the patients on nilotinib as on Gleevec experienced a major molecular response to their treatment, meaning the products of BCR-ABL were nearly undetectable in the blood. Similarly, more patients taking nilotinib than Gleevec had a complete cytogenetic response, meaning cells containing the BCR-ABL mutation could not be detected in the blood or bone marrow. Those taking nilotinib were also less likely to experience a progression of their disease. We had a chance to speak with Dr. Giuseppe Salio, one of the investigators of this study, who offered some further insight.
Apart from the fact that it's better, of course, not to have a disease like chronic myelogenous leukemia, but having the disease, they have been quite lucky because fortunately this happened to them in a period in which this disease has become, now we can say, curable. Imatinib is a great drug. I think that most of them that are presently in treatment with imatinib have responded well, and so there is no reason to immediately switch to nilotinib unless that they have some intolerance problems or some response problems. But for the new patients, although at the moment it's still a little bit early to say exactly, probably in the future nilotinib will become available, and this will probably give better results than in terms of rapidity of response with respect to imatinib. But they have already achieved, most of them have already achieved the response that they would like to achieve in a more rapid way with nilotinib. So there is no reason for the moment to switch to nilotinib. So I think that what is important is that although in the last 10 years, I would say a huge breakthrough has been done in the therapy of CML, and we have transformed the fatal disease in a really curable disease for most of the cases. And I think that in the future our aim must be to try to completely cure the disease and eventually discontinue the treatment. And this is a possibility that now we are facing. We have still to work, but I'm sure that in the future we'll be able to achieve a complete cure for this disease.
Today's research suggests that a new, more powerful drug that works in a similar manner to Gleevec, an agent that revolutionized the treatment of CML, may be even more beneficial for this condition. For Insider Medicine in Depth, I'm Dr. Susan Sharma.